Hello, everybody. Today we're joined by Dr. Sarah Williams, one of the doctors at Modern Med, and we're going to talk about a topic that we get questions about all the time. There's also some myths around it. It's not super well understood, and so we're going to dive into it because it's actually really common. And we're going to talk about two things, diverticulosis and diverticulitis, and how those are different things, but are definitely related. Hello, Sarah. How are you?
Hello, hello. I'm good. How are you?
I'm good. I'm good. We are just talking. I'm getting ready to move. So while it looks like a normal place from where you're sitting, if I move the computer any direction, it looks like
Boxes
mayhem. So
everywhere.
yeah, but it's kind of nice just to have like the tunnel vision of like, I'm going to pretend like nothing else is going on.
Yeah, it's good. Yeah, I'm really glad that we're talking about this today, though, because like you said, we get questions about it a lot. It's very common. And I also just think that it's a topic that there's a lot of confusion, which we'll dive into like the differences and things. But people very often get like diverticulosis and diverticulitis very confused. So we're really going to break that down today.
Awesome. Yeah. So let's just start talking about what they actually are first. And we can start with either diverticulitis or losis. I don't know which one's easier for you, but I know you want to show us some pictures too.
Yeah, let me share my screen here. So this is what we're looking at here. So we're talking about what's going on in the colon. This is like the normal looking colon, pretty smooth. And what we see here is diverticulosis, which is just referring to these diverticula that occur, which is essentially just an outpouching in the tissue of the colon. And it occurs in these like weaker areas of the colon wall. So that's all diverticulosis itself is referring to. And it often doesn't even present with symptoms. Where we run into more issues is when it actually develops into diverticulitis, itis meaning inflammation. And that's essentially what we see here is that these diverticula get inflamed or infected, and that causes more symptoms, which we'll be diving into. But that's really the difference between these two conditions.
Yeah. So you have to have diverticulosis in order to have diverticulitis,
Mhm.
but the two are actually very different in terms of one is an acute thing that's happening, diverticulitis, and diverticulosis is something that many people can be walking around today will never know that they have until they go for their first colonoscopy, likely.
Exactly. Yeah.
All right, let's talk about how common this actually is. Let's talk about diverticulosis first, which is just that outpouching.
Yeah. So in diverticulosis and itis, we really see that it increases with age, of course, and so pretty dramatically. So at age 40, less than 20% of people will have diverticulosis, but by age 60, 60% of people will have diverticulosis. So that diverticula being present.
That's huge. I actually didn't know it was that drastic of an increase from just the age of 40 to 60. So over 20 years, additional 40% will develop it.
Exactly. Yeah. So pretty significant. And then what we also see is that about 15 to 25% of people who have diverticulosis will end up developing diverticulitis. So that's about 1 in 4 people who have OSIS will develop itis.
Yeah. And again, you already clarified, but this is going to be 1 in 4 people who have the outpouching to begin with. So not just 1 in 4 people in the general population. So the numbers get smaller and smaller as we start to exclude.
Exactly.
And you said age is a big factor that increases. Any other risk factors for these things?
Yeah, so there's actually a lot of risk factors. So for just the development of diverticulosis to happen, the main ones that we see are just aging. Also, males are more common to have it, and smoking is a big risk factor, and also just being overweight or obese are the main risk factors for just the presence of the diverticula.
Any idea why any of those things are at play?
I don't know if there was anything really specific that was found with those. I think especially with being overweight or obese, I think just more pressure can be a contributing factor and just more inflammation that occurs with those things. And smoking, there's just more inflammation, which we'll be talking about, but that's definitely something that we see in people who have diverticulitis, especially.
Okay, somebody comes in and we're suspecting diverticulitis. What are some of the signs and symptoms? Like, what is that person usually experiencing?
The most common is definitely abdominal pain that you'd be feeling in the left lower side of your abdomen, and it's usually a pretty constant pain. Also, really common to have a fever, nausea, vomiting, as well as just changes in your bowel habits. So, about 50% of people will have constipation, so that's more common, but about 25 to 35% of people will have diarrhea. Those
Okay.
would be the biggest things that you would experience.
Other things in terms of diverticulitis, anything else that increases the risk that we haven't talked about already?
Yeah, I'd love to break this down more because there's some pretty good data out there. There's actually this study they did that looked at over 51,000 males at these different risk factors. They showed that if you had less than 4 servings of red meat a week, if you had at least 23 grams of fiber a day, if you had a BMI less than 25, and then if you worked out for at least 2 hours vigorous activity a week and never smoked, that if you had all of those, you were 73% less likely to develop diverticulitis, which is huge.
Okay, love it, and I think all of those make sense. I'll put the asterisk in the BMI one because I always wanna do that,
Yeah,
where it totally serves a great purpose for the general population and just research studies in general because
totally agree.
it's an easy way to group people. But I will say for people listening to this podcast and who are really interested in health optimization and longevity, there's gonna be a big group of people who that especially are men and have a BMI above 25 and are completely healthy because they have so much muscle mass on them, but they're still very lean. And so, no, if you're in that category, then I would say this likely doesn't apply to you. Who knows? But we have to do the research. But we're
Mhm.
looking at people who are overweight in terms of over fat and have a body composition favoring high fat.
Absolutely. Yeah, that's really good to note.
Awesome. That's really interesting, though. That's significant.
Yeah. Yeah, 73% less likely. So, yeah, very
So
significant.
physical activity, we talk about all the time, but that decreases the risk for diverticulitis even. I mean,
Mhm.
exercise, if it had a scoreboard, is always
It
winning. This is a
is.
surprising one too, where you're looking at inflammation of pouches in your colon, and the risk for that decreases with more physical exercise.
I know you wouldn't necessarily think those 2 would correlate, but like you're saying, it's just another reason to make sure you're getting consistent movement and exercise. It really is important for every aspect of our health and well-being.
And I know you looked into some of the research around like obesity and smoking, alcohol. Do you want to go through any of that?
Yeah, similar to what we talked about, obesity is a risk factor for developing diverticulitis. Smoking, of course, is too. Heavy alcohol use is found to increase the risk. So, if you're a male having more than 14 drinks a week, if you're a female having more than 7, is what was classified. It's unclear if less than that is a big risk factor, but all of those are definitely risk factors for it.
Okay, and then let's talk about medications because you and I have talked offline about this. Tell us in terms of if there are any risk factors in the medication class.
So the main ones with medications that are found are NSAIDs, so anti-inflammatory medications like ibuprofen and aspirin are the 2 biggest ones that are actually associated with an increased risk. We think that's because they're thinning the lining, so putting you more at a risk, of course, for that outpouching and for that inflammation to occur. There is definitely an increased risk there with those,
With
especially
chronic.
with chronic use. So, I mean, the research that I looked at was like if you're taking those 5 days a week, was strongly associated with it. But also, if you're in an acute diverticulitis flare, NSAIDs are not going to be the best go-to to manage your pain because it might increase risk of complications as well.
Okay, that makes a lot of sense. And then want to talk a little bit about vitamin D?
Yeah, so there's actually some good research showing that higher levels of vitamin D in the optimal range can decrease your risk, especially of risk of hospitalization and complications with diverticulitis. And then in general, there was a different study that showed UV light exposure can decrease your risk, and they correlated that to likely having better vitamin D levels, of course. So that's also really interesting.
Yeah, and we test all of our patients and get them in optimal ranges, and that's it. It's a really simple one to manage.
Yeah, and also such a common one to be lower in, unfortunately. A lot of people think they're getting enough sun, but we see it commonly that people still just aren't getting up there to the optimal ranges.
Yeah, especially 80% of my patients are in LA or Southern California, and it still is super common to be in a low range for vitamin D.
Yeah. It's amazing.
Genetics. Do genetics play a role here at all?
Yeah, so pretty strong correlation here. They suspect that up to 50% of people who develop diverticulitis are related to genetics. So there's definitely a strong genetic correlation here.
Okay. And I know we said we don't really fully understand what's going on mechanistically. Is there anything worth talking about that you found interesting?
Yeah, like you said, still unknown, both diverticulosis and diverticulitis. It's not very clear of what's actually causing this, but we're continuing to expand on our knowledge of it. So, in general, what we think for the actual development of the diverticula themselves is it might be due to decreased motility, which is related to decreased acetylcholine, which leads to slower motility, like more of the constipation piece that might just overall increase the pressure, and that could lead to the diverticula occurring. But it's actually kind of conflicting because overall studies are like, well, but constipation and a low fiber diet are not associated with diverticulosis. So hard to say, but I say that like with patients, I think it's definitely a big contributing factor, and it's definitely something that we always want to be working on.
Yeah, it's going to help improve quality of life for sure if you have constipation, but that's interesting that they are so contradictory. It kind of seems like the answer is we don't know currently.
Yep, exactly. But there is some newer evidence and research about diverticulitis more specifically of what we think is due to that. And we're really seeing changes in the microbiome might be playing a role, which is really cool and interesting and also not surprising. But yeah, so they showed that there were lower levels of beneficial bacteria like Faecalibacterium, and they also had higher levels of Prevotella and Fusobacterium, which were more dysbiotic or inflammatory strains that they found for diverticulitis.
Got it. So would you recommend people doing a stool test to look at their levels of those?
I would not at this point in time because we don't have the best testing for it to really evaluate that accurately.
Yeah, that was a trick question.
I know.
Um, but I think that people hear that and then they say, oh, Prevotell is measured on this GI test, and here's where I'm at, so I want to change it. And these are all associations at this point. And I think they're really
Mhm.
interesting, and that's where we start, and then we research it and we say, okay, if we change it, do we not get diverticulitis, or does everybody with this amount get diverticulitis? Is it actually causative? And I think this is where we get into a lot of trouble with translating the microbial research into clinical practice at this point when we just don't know the answers to these things.
Yeah, I totally agree.
But it's interesting nonetheless, super interesting. And, I just can't wait to follow it and see if anything comes of it where it is actually applicable
Mhm.
clinically for us to balance it and potentially it begs the question of we probably need to get more specific treatments that are targeted approaches because using these broad spectrum or antibiotics that kill more of the things there, then we're potentially putting out a fire to create a bigger fire later. And that is not me
Mhm.
telling you not to take antibiotics.
Mm.
That is definitely not what I'm saying. I think that we need them, and
Yeah, they're
especially with
needed.
something that can be more serious like this if it's not treated, but
Mhm.
also a potential avenue for future treatment options to evolve from.
Absolutely. Yeah, I totally agree. It's really interesting to think about it that way.
Yeah.
Another thing that I found that was really interesting in the development of diverticulitis that we think is still a theory at this point too, is looking at those inflammatory markers that I hinted at earlier. So we do see that people prior to getting diverticulitis were found to have higher inflammatory markers like CRP, which is C-reactive protein, and interleukin 6. So there is some sort of inflammatory component driving this too.
Yeah, and you can see elevated CRP in people with obesity as well, so that may be part of the overlap that's there too.
Yeah.
Let's go into complications because we do want to talk about making sure people actually treat these if needed. So what are some of the complications that can occur?
The most common one is bowel obstruction. So, essentially, like it says, you get a blockage that occurs. Some other things are getting a stricture, which is more of a narrowing of the passageway, an abscess, a fistula. Those are some common complications that can occur. They are estimated to happen in about 12% of people who have diverticulitis. So, luckily, it's not super common to develop those, but it's definitely something to be aware of. And of course, the symptoms would be fever that's getting higher, you're not able to get under control control, pain that you're not able to get under control and worsen. So those would be some things to definitely look out for.
Okay. And if your doctor suspects this is obviously going to be something that's managed by your doctor. What tests may they order?
The diagnostic test is a CT scan to see if that's what is occurring, but we can also do some blood work. Like I mentioned, you can test a CRP really easily in a blood draw, which looks in if we see it's high, it could be indicative of diverticulitis. We might also see increased white blood cells indicating an infection. So those would be some other things that we could look at too. But ultimately, the CT scan is really where we find it.
Okay. And usually, what would be prescribed as a common treatment if they do find diverticulitis?
Liquids. So you want to avoid solids in these acute phases, like we mentioned earlier. Also, just general pain management.
Yeah. And then, more importantly, because we're not looking for acute treatments on a podcast, but we're looking really to see prevention. So, there's so many people, like we said before, especially over the age of 60, that have diverticulosis that was just found incidentally on a normal colonoscopy. And if you have diverticulosis, what are some of the things that can help prevent diverticulitis?
Fiber, fiber, fiber. That's the most important thing. So I usually say at least 35 grams of fiber a day. And also just kind of going hand in hand with that, a diet that's going to be high in vegetables, fruits, and whole grains. And then it's so important that we're touching on this too, is because this is a big myth, but nuts, seeds, popcorn, those are all actually really good to help prevent diverticulitis. There's a big myth that those are going to cause it or worsen it, and that's just really not the case. So that's really important to note too.
Yeah, super important. And then there's a few other preventative things that we had discussed, which we've already highlighted, but let's just repeat because I think they're so important.
Yeah, it goes hand in hand with the risk factors we talked about. So limiting alcohol, quit smoking if you're a smoker, managing your weight, consistent movement and physical activity, and avoiding high amounts of red meat.
Yeah, awesome. Super important. Anything that we didn't talk about that you thought was really interesting or people should know?
I think we covered all of it actually.
Yeah, I think we did too. Thank you for this. It was a great refresher and a deep dive into some of the new research too. So really appreciate it. People know that they can find you at modernmed.com to do a complimentary phone consult, and we'll chat about something new next time.
Sounds good. Thanks for having me.
Thanks.